Good afternoon, everyone. Welcome to today's Indians program on child and adolescent psychiatry. This is the second session on child and adolescent psychiatry. Today we have Dr. Rajendra, who is Assistant Professor of Child and Adolescent Psychiatry at NIMHANS. So he'll be dealing with child development today. Over to you, Dr. Rajendra.
So, thank you, Chetan, for the introduction. So, good afternoon, all. Hope I am audible to all. So, as it was mentioned in the first Saturday topic regarding child formulation, a series of lectures have been planned, and today is the second topic. And today's topic is regarding child development. What I will try to do over next 40 minutes is to give a construct or a template where you can understand and remember that how development happens across how many domains, and in each developmental stage how does it happen. So that is one aim, and second one is that how and what are the understandings behind this, like how we understand that development happens, and what are all the types of theories proposed, and we try to understand according to them. So coming to the outline, let us start with knowing why it is important. Then there have been three approaches which has been majorly used to understand the development concept. There are 7 domains of development which happen over 3 stages of childhood: early, middle, and adolescence. So, and again, clinical application. Clinical application will be more of same as why the topic is important, but we may have more revision and also more depth of understanding, like where all in clinical situation we can apply this. So coming to the approaches that we have, and the understandings why we should do this. So whenever we want to see a child, we should be able to understand like how the presentations will happen. Like the presentations may vary. For example, a adolescent who is depressed may present with irritability and anger. A child who has OCD may not directly present, and it may take long time to disclose, and they may have more compulsions than obsessions in the early age. So even the anxiety, emotions related to anger, few are normal to age, few are not normal. So to understand the different clinical presentations, and next is clinical evaluation, how we can understand in which level this child's abilities are, in which domain the child has deficit. Does the child have emotional regulation deficit? Does the child have self-esteem issue? Does the child has identity concerns? Or does the child has speech and language problem like learning disorder? So this understanding will help to understand and carry out the clinical evaluation. And the third point is to interact. Like each child age, we need to interact differently. For example, if we are evaluating an infant, we need to know how to stimulate a child, how not to make the infant anxious, how you can carry out the evaluation. So like similarly in the preschool age, in the early childhood, your approach will be different. Even if a child is anxious, then you will take a little more uh, vigilant or small, very child-friendly approach. But in adolescent, it may be completely different, where you need to treat him as an adult, you need not to look him like a child, and you need to give each and every aspect importance, like confidentiality, then privacy, then you need to discuss all these issues as if you are talking to an adult. So it has impact on the interactions. And lastly, the interventions you carry out. For example, a child has a fear. You can't do a formal CBT or any other school of therapies. You will need to do a play-oriented work or a play task related activity where the child will rehearse. You may need to do a psychoeducation or concept building through a story method than a formal way of approach. So this is much needed in all aspects of our clinical assessment, understanding, interaction, evaluation, and treatment. So this is the importance of the today's topic. So like what and how this concept has been understood, like how people, different streams of researchers or the uh, experts have tried to understand the development. So there are three schools of thoughts, schools of understanding. One is sociological and ecological, second is psychological, third is biological. So let us see like each theory what they have proposed. When it comes to ecological approach, Bronfenbrenner has given an importance that how it is very important that each system has an impact, and the systems will define will be uh, very much needed for the child to grow. And what is the capability of system, how much the information or the training that happens in the system, that much the child can develop. So that is how a society which is organized helps the child to have a adequate development. Next person who also took social approach or cultural approach for his understanding is Vygotsky, where he mentioned that society, the social interaction gives a template for a child to learn, and that template is in the zone of proximal development. Means a child knows ABCD, then the child will be taught letters, words, a simple words, then a small sentence. Means each learning will be having a template, and that template will have, that social template will be provided by the social interaction, and that will happen much through the language. So he stressed on the importance of social availability of the learning and also the language importance. So this is Vygotsky's theory, which tried to allude to the development. Then comes Erik Erikson, who tried to take psychological and social approach together, where he tried to define what are the uh, stages in which a person goes through in a social and psychological sphere of development. So until 21, you can see that from toddlerhood to the middle childhood and adolescence, how different stages develop. So this is one approach of understanding where the social aspect, the language, and the socio-cultural milieu gives a lot of things which is needed to a child, and child will learn or imbibe from this environment and atmosphere, and that is very important, is what this theory suggests. Next is psychological theory. The earliest one is Freudian one, which is more for therapy and therapy oriented understanding. So but next level is given by Piaget, where he mentioned the cognitive development. So you can understand that he observed his own children, and the keen observation made him to understand how a child is able to interact with the environment, and how he can manipulate the things around for his needs, and how he can learn. And he has given the 4 stages of Piaget, which is very important. So this is the psychological approach, where a person's ability to do a task, to learn and to apply will evolve with time, with evolve with age, but you can group them based on their abilities in each different ages in which they develop the abilities. So I will come back to this slide again in the later time. So the last school of thought is biological. So we discussed what is happening in ecological what are the ecological importance or social importance, where there is a need of template, there is a need of resource. The resource should be fed in through the language. The template should be closely means the child should be able to pick the template. To that level, the template should be provided. So that culture gives. With this, the child will learn with age, and his ability to learn and apply will improve. So meanwhile, what is happening in the biological domain? So this following few slides will have pictures depicting understanding of the biological underpinnings of the development. So you can see in these slides where the growth, how does the growth happen? Like you can see that with age, white matter gradually increases, which is the cortical white matter, which is uh, slightly red colored one. Cortical gray matter, you can see it grows up to 1.5 years to 2 years. Later on, it is much more same. But you can see that fractional anisotrophy means the tracts formation is increasing with age even until the end of childhood and youth. So the dark blue line or the violet line and the light red line, you can have a focus on this, and you can see that with age these two are a continuous process. But when you focus on cortical changes, that is much more restricted to early 1 or 2 years. This is at the first level. Second, with these images, you can see that a child who is in 2 week old versus a child who is 1 year old, his brain size doubles. And what happens? So the cortex grows in this time a lot. And you can see in the next picture where the surface expansion heading is there, you can see the red colored areas are the one which expand more. You can see the temporal, the visuospatial, and the prefrontal area are the most which expand a lot. So this is the gray matter changes which happens within early year or two. So in the third picture of myelin maturation, you can see that within a 1 year of time, from day of 3 months, like 107 days, to day of 12th month, you can see how much the myelination is increasing. So the huge amount of myelination that happens during the first year of life and up to second year of life. So in the picture A, if I want to point out, you can see this here, because of lack of myelination, the white matter is also looking gray. But you can see by 1 year, it has taken almost an adult form where the white matter has gotten myelinated and the size has doubled. So this is one level of discussion. Coming to understanding it further, so you can see, like even I mentioned in the previous slide, that these three areas are important: temporal, prefrontal, and visuospatial. So you can see here that the auditory visual areas of cerebral cortex develop, means increase in surface areas happens much more earlier, followed by language areas, later on followed by prefrontal cortex, which continues to have cortical reorganization with synaptic increase, and followed by pruning even until adolescence. So this is like how with age the myelination is increasing in those tracts in those particular areas. So this is a picture regarding neuroimaging understanding of child development. There is one drawback that we always should keep in mind, even though we understand all this, that doing an imaging and doing a perfect imaging during the childhood, during the infancy, is a very difficult task because of the movements and the artifacts. So even the Reuters gives a point after having a summary of these studies, that we should take it with a pinch of salt. So you can see that in resting state network, there are different networks: somatosensory network, then visual auditory network, visual network, then this is frontoparietal network. This is also frontoparietal network related to executive functioning. This is default mode network, where you can see that with age, the area in which the activation happens gradually gets more specified. So that is the importance of this slide. So similarly, when you can see that there are around 5 to 6 layers, it's 5 layers in the cortex, where the layer 5 fibers will reach thalamus and subcortical areas, which expands early. But in layer 3, which has intercortical connection between the other cortex and the other cortical area, you can see how the neuron, the pyramidal neuron there, gets its dendrites developed, how it becomes more complex, and how it gets organized with age. So overall, to understand all the 3 approaches, social template is needed. The template should be available in a understandable format, which is easier for the age appropriate learning, and that should be communicated through language. That is what ecological theory or social theories suggested. Coming to the psychological theories, it suggested that with age, the ability to understand, learn increases, and also as they grow, they are able to reason. So in the 3rd level, if you want to have a biological understanding, you can understand that initially the cortex is getting reorganized and also increasing in size. Then the myelination is happening. As the age grows, the specific areas of cortex will have more specialization and have interconnections which have specified functions. So these are the 3 approaches to understand the development. So coming to a concept, like when now we discussed, there is the aspect of social and environment, and also the biological aspect. So always there is a debate like which is important, nature or nurture. So the research has clearly shown that both are important. So genes have the storage capacity, but it can be made use of in the presence of environment. If the environment is depriving, then it will have a deleterious effect on the child's development. So this concept has been understood, like what in children, the temperament, the traits, the personality traits we have, the studies which give us knowledge about the genetic aspects of it, from twin studies, family studies, or hereditary studies, it shows around 30 to 40% may be explained by that. So 60% environment need is the one which can explain. So when it comes to understanding between gene and environment, one way is gene environment interaction, means there is an environment and that environment can have a different effect on the child development. So means if you give an example, if there is a deprived environment, it will have definitely negative effect on the child development on socio-emotional and language growth. That has been proven by studies. But if the environment gradually become stimulatory and also which has the stimulating capacity, the child who learns in this environment may also pick things in a different manner. That is what gene environment interaction tries to explain. Next is gene environment correlation. So there are 2 types of correlation which have been explained. One is passive, one is active. Passive means if a father is a musician, child gets exposed to music in the home, and also he learns the music, which will be easy. So there is a genetic component to it, and there is a passive component in your environment which is already existing. So that can have an impact. Next is active correlation. Active correlation means that a child has certain type of genetic nature and he evokes certain types of environment. This has been studied. For example, if I want to quote a study where they have a parents, mother of a twin versus mother of non-identical twins, identical twins, non-identical twins, and uh, siblings, normal siblings. The identical twins evoke same response compared to non-identical, versus those who don't have, who are not twins or siblings, have completely different response they evoke from the parents. So this genetic component which evokes particular type of response is also important in understanding how gene and environment interact. So these are the two ways in which the gene and environment related influence have been tried to understand till now. But in recent times, maybe in last 5 years or so, this epigenetics has taken a leap in the domain of research, where there is no gene modification, but the gene expression can be modified by the influence of the environment, and it appears to be bidirectional. Means the environment is there and the gene is there. In between that environment, the behavior. So the behavior, if it is in the middle, for example,
வீடியோவே வரலையே எனக்கு.
so in, for example,
ஏதோ ஒன்று வந்துச்சு.
sorry for the disturbance in the audios. So epigenetics is where a behavior, a environment can increase expression of certain genes, or a certain environment can decrease the expression of certain genes, which can lead to psychopathology. So DNA methylation is the mode which is very well studied, and the attachment behaviors of the animal has been studied in this aspect. So now we have an understanding about in what schools of thought we understand and how the environment and genetics may interact with each other. Now moving on to the core of the topic, like in child development, in a week we have 7 days. So if you remember that, you can remember that there are 7 domains of development. So there are 7 domains of development, and I am trying to put this concept for only for remembrance purpose, not that it happens in an order. So you can remember that motor development happens to some extent in vivo, means in utero. For example, a child by birth able to move limbs, have some basic reflexes. So motor development is the one which is there almost in utero itself. So emotions, birth cry is not an emotional expression, it is a more of a reflex. But you can see that when the child gets born, the parents will be in a joy, but the situation is quite paradoxical, where the child is crying but parents are laughing. So that is a situation where even it is naturally expected. So emotions, even in the early infancy, the pain reflexes make the child to seek for the food. So later on the emotions develop. So emotions are much more related to the subcortical structures and controlled by the frontal structure. So you are talking about limbic system, which also has a component of reward. Third is social, like child learn to smile by 3rd month. So child will be able to attend to the complex facial expression and interaction cues by around 2 months, and by 6 months he can imitate. So the social domain or the social aspect of it gives a template. Means child will have a interest in socializing, looking at the parent's face, looking at the parent's eyes, maintaining the eye contact, so mimicking their interactions. So child has innate social interest, and child has developing emotions. So you can understand that social and emotional domains are key for development. social domain gives a interest and a curiosity to learn, to see and learn. But emotions decides that it should be learned or not. So emotion is basically a reward, where a child gets a reward that is learnt more. Then it becomes easy for the child to memorize and learn further. So social and emotional developments are the key domain for other domain of development like speech, cognition, moral, everything. So these are the three first domains of development. Later comes speech and language, then cognition. So child will learn the sounds, then the meaningful words, then the sentences, then the complex grammar, so on and so forth. Then the cognitive development, ability to remember, ability to utilize the information, and moral and sexual development. So basically we have 7 domain of development in childhood. I have not taken empathy as a point for the today's class because these 7 points are also very important, and if we can remember them, that is very useful. What I will do is I will try to go through the each domain of development in elaborate fashion, where we can trace how each domain develops across age, means from infancy to the adolescence. At the same time, we can understand how in each stage of childhood, early childhood, middle childhood, and late childhood, they have different abilities in this each domains. Coming to the motor, they have fine and gross motor abilities. So gross motor abilities will help us to understand and detect the delays earlier, like sitting, neck holding, sitting, standing by 3 months, 6 months, and 1 year. So like that, fine motor movements with pincer grasp at 9 months, scribbling at around 1.5 to 2 years, putting a circle at 3 years. So with age, the child's ability to control the body movements comes from head to toe, and in the limbs from proximal to distal. And as the age grows, the ability to carry out the fine motor movements with visual coordination and balance related activities improves. So this is overall in gross related to the motor development. You can imagine a situation where the child has cerebral palsy, and if the child parents are not able to recognize, or if they feel that he is unable, they may respond less emotional to the child, or they may not give adequate educational stimulation. That itself can have an effect. Later on, child may have difficulty in attending to the regular schools because of the motor difficulties. So even one domain deficit in motor can affect other domains of development in a child. So this is related to motor. I am not going elaborately into the motor development. So proximal to distal, it happens from neck to toe. As with age, the cerebral capacity, balance capacity increases. So neck balance, trunk balance, then the ability to walk, then ability to run, then ability to hop and also stand on one foot. So this is how the improvement happens between the motor, gross and fine motor movements. Coming to emotional development, as I said, as we know, there are 4 basic emotions: anger, sadness, fear, and last one is happiness. So happiness is a positive emotion. Rest 3 are negative emotions. And with age, what is the task for a child? So with age, task for child is to learn to control negative emotions or master negative emotions, and also to master how to seek positive emotions, like how the child can seek happiness. So coming to the anger, it increases until toddlerhood. So until 3-4 years, tantrums are developmentally normal. So as the child grows, child will be able to talk to himself. That is private speech, we say. That is a mode of anger regulation. Later on, gradually, child learns to postpone or delay the gratification. The child of first standard needs chocolate immediately or by the evening. The child who is in the third or fourth standard will wait for a gift maybe for a week or a month. But in adolescence, we may need to wait for years together for something which we want. So, as with age, we will learn to delay the need of gratification, and with, as I said, with age, initially we will try to talk to ourselves and feel better by putting out the emotions. But as we grow, we will be able to process it inside our mind, and we will learn how we can handle the situation by processing further in the mind by addressing the problem. So this is how with age we learn to master the anger. Until third to 4 years, like toddlerhood, they are not mastering. By middle childhood, they have quite an ability to delay their needs, understand the explanation given by the parents, and by maybe in the middle childhood to adolescents, they learn how they can resolve the conflict, how they can look into this problem situation and how they can solve it. So this is what happens with anger. But in adolescents, they become a little bit moody and they may be a little bit more irritable and argumentative. That is the developmental aspect of anger. Coming to fear, children's in the toddlerhood will have fear related to some natural aspects like light, darkness, then the height. So any injuries, they feel very overwhelmed. So they will have increased threat perception, even separation from the parents. So this is in the early childhood. In the middle childhood, the fears will shift to the natural threats which are there, like dogs, the lightning and thunder. So like those aspects which are in and around us. But during adolescence, this fear and anxiety moves towards self ability, self appearance, self capabilities, social capabilities. So this is what the fear which an adolescent needs to master. So you understand, the fear which need to be mastered in the early childhood is different, which are more natural related phenomenon and separation related phenomenon. Then in the middle childhood, it are more of related to phobias. In the adolescent, it is more related to social anxiety and social situations. So this is related to the fear. Then what happened to sadness and happiness? So as I said, children will learn to talk to themselves and the private speech in the early and middle childhood. In the late middle childhood, by 7 to 10 years, child will learn to address any emotional problem in two manners. One is emotion centric approach, one is problem centric approach. Means child with the help of a parent or a teacher will learn that what all the steps can be taken to solve this problem so that I can feel good. If that problem can't be solved, how I can speak to others, make something and allow it, let it go. So the child will master this by around 9 to 10 years. So this is the duration when the child will also have ability to metacognition. So as I said about anger and fear and sadness, the child's ability to seek happiness also evolves with age. The young childhood, they will try to interact with play, they will try to make parallel play, they will make the what we call it as role plays. So then they will play the rule based games. So this is how they try to get the happiness. And by the middle childhood, the happiness is also in the indoor games and also about their academic performance. So as they grow into adolescence, social acceptance, their ability, their performance, so their interests, like which may be reading, their hobbies. So as we grow, our ability to seek happiness, the tasks will change. But as we are reaching adolescence, we will find some ways which are interesting to us, and which makes us feel good even when we are having negative emotional states. So this is regarding the emotional development, what happens in early childhood, middle childhood, and late childhood, what happens to these 4 basic emotions, and how we learn to handle them. This is emotional. Coming to social development, social development has, we need to understand it in different aspects, like how a child will learn about self, how and what factors contribute to development of self-esteem, and how it evolves with age, what happens to identity. So all these develop in an environment, in family, in school, society, and peer relation. So I will try to address this in detail. So as I said, by 2 years they will have a bit of self-awareness, they will know their names, they will be able to identify the close people. So but by 3 to 5 years they know what are good behaviors, what makes others also feel good and they can get praise from. So even then, but they will not be able to think what other person can think about them. By 6 to 10 years they have a capability to think that what others may think about them, and you need to understand this and also remember this aspect very carefully, that by 6 to 10 years child will behave more in socially appropriate manner. For example, if they have any problem with parents, they will not directly tell you, because they feel telling like this is not acceptable. So to take anything out related to their family and those things in this age group takes lot of time, and many time in this age children also feel that they are responsible for whatever is happening in the family. For example, if the parents have fights, they think that why I am their son, I am born, so because maybe because of me only they are fighting. So they reference themselves, and also they try to give lot of social appropriate answers. So in this age they also try to understand like about each person's attribute, what are good attributes, what are bad attributes, and they will start comparing to others. So by 11 years or so they are much more abstract in the concept. They can understand that there are both positives and negatives aspects of self, and they will be able to focus on their positives to build their concept much stronger. So as I alluded to, self as a concept which increases with age, the understanding where the attributes will be understood little bit as good or bad, then they will be understood as they are coexistent, then they will be able to focus on the aspects which they are good in. So coming to the esteem, self-esteem, any child, the self-esteem depends on 4 components as you see in the table. One is the child's physical fitness, child's competency, maybe in sports, in social abilities, or in academic competency. So the self-esteem, I will go to the next slide and come back to this one. You can see that with age, self-esteem also starts crystallizing. It much more takes a role in 6 to 10 years, where the child will be able to understand these competencies and feel good or not regarding their competencies. By adulthood, that competencies will also much more moved into social domain, where it involves friendships, job competencies, and also the uh, uh, close relationships which they can share. So the self-esteem concept try to start by preschool. By middle school it is much more dependent on the competencies which are more physical, sport, or academic related. And as they evolve, grow into adolescents, it the social component of self-esteem chips in, and that also has lot of factor to do. You can see many adolescents who are not confident to talk to their peers feel very low, feel very anxious, or feel low regard. Because of that they feel less confident. So that adolescent gives more tasks which need to be mastered in the social domain. So as I was mentioning, this more pertains to the middle childhood, the social competence takes much more precedence during the adolescence. So coming to the identity formation, by late adolescence and early youth, child will be able to identify what are the strengths that I have and what is my area of goals that I have in different domains, maybe personal, social, and also professional. So that is what a normal achievement will happen, where there is adequate exploration. This happens in a correct age, and they will move on to next stage. Then this is moratorium, means the person remains inconclusive. What I should become, should I become or not? He will not be able to make a clear choice on any of his professional goals, social goals, or even family goals. Foreclosure, where the child even around 14-15 years only decides what he should become, and he has not adequately explored his strengths or the social availabilities which he can use for that formation. Diffusion, there is nothing which is there, like there is no goals, no values, so there is no clear defined aspect of oneself, and they will not be able to work towards any directed. So as I mentioned, we discussed self, a concept which evolves over time, where self remains as good or bad, self remains as abilities. As adolescent, self is understood as both the self as positive and negative aspects, and I need to focus on the positive. In the same way, in self-esteem concept, it is more dependent on competencies other than social competency in middle childhood. The social competency takes a major role as they enter the adolescence. And as they enter the adolescence to the youthhood, how much they explore, how much they can look into their self-esteem, self-concept, and make an goal in a very planned manner will give identity achievement. But it doesn't happen, then this other forms of identity can evolve, and that is given by Erickson. So coming to the peer play, peer relations, what happens? By 3 to 5 years, they want to play. They will play initially parallelly, then they will make some constructive games, and then they will try to do role plays. Later, they will play rule games, and they will try to enjoy this. And in the preschool, you can see that there is no gender related peer affiliation. In the middle childhood, the gender related stereotypes, gender related peer affiliation increase, and during this the friendships are made, and sometimes they will get broken based on an event or based on any negative experience. But as they move into adolescence, the confidentiality, the secrecy, and also a person can be sometimes bad, sometimes we can have a fight, but we need to resolve. So long standing friendships tries to start in the early adolescence to late adolescence. So this is regarding the peer relationship. Regarding the school gives a templates of social norms, social rules, and also moral values. In the morality, I will allude to it. Coming to the family, the attachment is very high, or the complete dependence is there until preschool. In the middle childhood, they start to affiliating with peers, but the same amount of interaction will remain with parents. But in the adolescence, much more interaction will shift to the peers compared to the family. As they reach into adolescence, they will try to take part in society. They may question the existing norms. They may try to have develop a social appeal. They will engage in social activities, group activities, which are good for society. So this is regarding social development, and as they evolve, they will also learn regarding the family values by adolescence, and that family values will also have a lot of impact on their behaviors. So we have discussed emotional development. Now we have discussed social development. So as I said, social development or social atmosphere, social interest gives a avenue, and emotions gives ability to learn. So next is speech and language. The speech and language, as it grows with age, the speech is ability to produce sounds. Language is ability to use it in a meaningful way for the interaction. So by 1 year, they will be able to produce a meaningful word. By 1.5 years, 2 years, they will be able to use 2 words. They will be able to use a verb and a noun combination. There will be no tense in it. By 3 years, they will start asking questions. By 4 years, they will be able to tell a small narrative, small story. So by 4-5 years, they will be starting able to learn, read and write the letters. By 6-7 years, they will start using the tenses. So a child learns language until third or fourth standard, until 7 or 8-9 years. Later, using the language, they will try to learn the knowledge. So that is how the school works. When it comes to language, there are 5 components to it: phonemes, syntax, phonemes, semantics, morphemes, syntax, and pragmatics. Phonemes is the sounds. Morphemes is how by varying the sounds we can change the meaning of the word. Semantic is the exact words which we use. Syntax is how we arrange the words in an manner which has a tense, which has a verb, which has a noun, which the sentence can be made in an understandable form. Pragmatics is more to do with body language and non-verbal communication, and around 70-80% of our communication has implications through the pragmatics and not only the language. But during preschool and during middle childhood, the growth of speech and the word vocabulary is exponential. Beyond 12-13 years, the speech acquisition will not happen. So this is regarding speech, and the speech gives an avenue for learning the concept and also for the cognitive development. So coming to the cognitive development, you can remember operation as a word. So concrete operation, pre-operation, and formal operation. Then there is a sensory motor stage. So you can remember Piaget's theory as I showed in the previous slide. So you can see here, if you can remember 2 sticks. So 0 to 2 is sensory motor. 2 sticks, if you combine it will become 7, pre-operational. 7 to 11, concrete operational. Beyond 11, formal operational. What happens? Sensory motor, child will learn and interact with the environmental objects and also even the toys, but the child will not have any concept related. In pre-operational stage, they will know cause and effect relations, but they will not know still more better ability of using the logic. So logical ability, like things will the matter which if you put a glass of water in a plate versus in a glass, the water will look bigger in a plate, but the child's ability that the both have same quantity, those abilities will develop between 7 to 11. But beyond 11, they are able to hypothesize different possibilities for a given situation. So you can remember, if you remember this stage, you can remember other stages also. In each of these stages, their language ability is increasing, their emotional capabilities are increasing, their self-understanding, their self-esteem is also evolving with this amount of understanding. So cognitively, there is a concept, there is a concrete understanding of concept, there is a semi-abstract or even an off-logic level of understanding of the concepts and things around our environment. Beyond 11 years, child will have a ability to generate hypothesis or even deduce some amount of complex information to a gist information. So this is the cognitive development. Last 2 are moral development and sexual development. Give me a minute, I will just check on a time. Sorry, I will try to
350.
I will try to finish it, wrap up within another 5-6 minutes. So moral development, you need to remember 3 stages. So conventional, pre-conventional, post-conventional. This has been given by Kohlberg. Pre-conventional means the rewards define it is good or bad. So if you tell a child that if you cut a neck of a chicken, I will give a chocolate, the child will not know it is good or bad, but child will do it because it will get a chocolate. So that is pre-conventional stage. Conventional stage, teacher will tell that these are the norms, these are the rules that we should follow. If we don't follow, this is the punishment. That's why we all can have a normal life without breaking the rules. That is conventional stage. Post conventional, where the child can think given a situation where the situation or the context makes the person compelled, even if he breaks the rule, that is okay. That is post conventional level of moral. So until middle childhood, it is more of a conventional one. By adolescence and later adolescence, they will reach the post conventional one. Coming to the sexual development, we should understand that there is 2 aspects, knowledge and behavior. So until around 3 to 5 years, they will have no knowledge and they may have self-stimulatory behaviors. By 7 to 10 also, in the middle childhood, 6 to 10, their knowledge remains limited and some amount of experimentation with other peers is normal. As they grow into adolescence, they have changes in their psychological and development related to sexuality, and also physiological related changes related to sexuality. They develop desire, interest, and also certain self-stimulatory behaviors which are normal. So as I mentioned, gender, child will be able to label him by around 3 years. Child will know that it will never change by around 6-7 years, and child will identify himself or herself based on the stereotypes the culture provides. By adolescence, in the toddlerhood, self-stimulation is quite norm behavior. When the parents reprimand them, they will try to learn that it is wrong. In the middle childhood, some amount of exploration when there is no monitoring may be normal because they are not unaware of what it is and what are the aspects related to it. Coming to the adolescents, they will develop interest, they will develop certain particular behaviors, but key thing, they also need to learn or to make correct decisions. So this is where we need to intervene. So these are the 7 domains of development. Coming to the last slide, like why it is important. See, basically, if you want to elicit relevant history, for example, a child, if he is anxious, angry, what he does to control it, you should know that where he goes to self-talk, what he talks when he is talking alone, for how long he talks, so that you can understand how that emotion is prevailing in the child mood. Then you need to be a key observer to understand the child's ability in all domains when it comes to a social clinical interaction, and you can do this even while interacting with the parents. Then you can use appropriate tasks to understand the child, like you give a drawing or you give a 3-wish test. So then based on the child's ability, especially for the middle childhood people, if they are quite inhibited, you will start an activity based approach of interaction than a direct one-on-one interaction. Then this knowledge will also help us to differentiate what is normal versus how it is pathological. Second is how different symptoms can present little bit differently in the childhood. Third, it will help to decide what kind of approach I should take while interacting with the child. So that is very important to develop a rapport so that you can intervene. It will also help us to choose the mode of intervention. For example, a child likes a way of storytelling, or a child likes drawing, child likes reading. So we should use whatever the treatment we want to in the child friendly manner and age appropriate manner. This understanding of 7 domains across age also gives us a template to understand where in which domain the deficits are there and how I can intervene. it has a forensic importance when it comes to a case of abuse. Thus the child has the ability to narrate a story. If you take cognitive ability and also social ability, this will start evolving by 3 to 5. It becomes much more better by 7 to 11. Beyond 11 they have much more capability. So all aspect of child psychiatry is dependent on developmental perspective. That means when you see a child, you should be able to understand what is going through his in mind, given the environment in which he is growing and his nature, how I can interact with him so that he is able to connect to the clinical interaction. What are the interventions I can select based on his interest and his age appropriateness to improve those behaviors. So with this, I will close my presentations and open for brief discussion.
Thank you, Dr. Rajendra, for your presentation.
So to give two references, Laura E. Burke, the Child Development book, that is the best, and the Clinical Interaction and Day-to-Day Interaction. So it takes maybe 6 months to a year once we start interacting with the children to understand a child from this perspective and also carry out your interventions or interactions. But once we do the practice and the trial errors, I think we will be able to master.
There are a few questions. Dr. Neha has asked, can you explain the identity status once again? For this, probably now the time is over. Probably,
yeah,
we'll put this up in the YouTube.
So yeah, definitely. Basically, this identity, what the last thing I explained is given by Erickson, where the identity is correctly formed versus it get diffused or it doesn't form at all. So that can be that is where it happens between adolescent and the youth. Coming to the moral development, yes, definitely in each of this stage there are sub stages, but because of the time constraint, I try to give that just that there is a conventional, there is pre-conventional, post-conventional. Pre-conventional more depends on the rewards, conventional depends on the rules, post-conventional depends more on the empathy and humanity and situation.
Why any intellectual deficit in preschoolers is called developmental delay disorder rather than intellectual disability?
Yeah. Before 5 years, the definition has been chosen to have developmental global developmental delay than a intellectual disability, because to avoid confusion regarding the diagnosis, because if you give a label at this early age, it can be of different causes and we may have not completely ruled out the cause, because that can happen because of different causes. So given the situation, that nosology clearly states that we should use global developmental delay before 5 years. To add on to, it is also difficult to grade the development below 5 years, like how much percentage of development has been delayed in this child in such an early age. It is quite difficult. So second reference which I was telling is the Rutter's book, which we can refer, where you can read about this fear, this emotional development, this anger and irritability, emotional development which happens.
For all the people who are asking about the PPT, we'll upload this session in our YouTube channel, NIMHANS Indians. So you can kindly subscribe to our channel and you will find not only this, but also other videos which we have taken. We have conducted until now about 38 sessions. So you will find all the videos in our YouTube channel, NIMHANS Indians. Kindly subscribe to the channel and you will be able to see them.
Thank you all once again. And if you have any queries, you can mail me on drrajendrakm@gmail.com, drrajendrakm@gmail.com. I will be happy to respond to them. Thank you.
Thank you, Dr. Rajendra. And also we thank Linux Laboratories Chennai for their support through educational grant.